You're listening to Charting the Future, a podcast for independent pediatricians by PCC. For more information about our software and services, please visit www.pcc.com or visit us on social media.
Welcome back, friends, to Charting the Future. This is Chip Hart, and I've got on the call with me today is Nelson Branco, Dr. Nelson Branco from Tamalpais, California. Say hello.
Hello, Chip. Good morning.
How are you?
I'm doing well. I'm looking forward to chatting.
All right. And here's my surprise question for you today.
Uh-oh.
Do you remember where and how we met?
Do I remember where and how we met? So I think that the first time we met in person was at NCE in San Diego.
Yeah.
When PCC hosted a dinner at Stone Brewing.
Oh, no, there is that. No, we did meet before that, but it was just before that.
Oh,
that was an epic evening going to Stone.
That was a good evening. I have to say a shout out to my good friend Toby Cox, who I met at that NCE where we met virtually on SOCM. So I like to tell people we when they ask how we met that we met online. But yeah, that was a fun evening. I got to meet a lot of my close PCC friends there. But when did you and I meet before that?
So just before that, it was at the NCE. I believe I was in the back of the room. You were in the back of the room for Section 8.
That tracks.
Yep. And you were carrying a black and yellow bag made out of seatbelts. And I said, "Are you a Bruins fan?" You dropped into the accent, and I was like, "Oh, I know this guy."
So what do you think? You want me to do this one Fall River, or should I go California?
Yeah,
because it's always there. I mean, it's just right under the surface.
That's right. Yeah, if we need someone threatened lightly.
I actually just a couple of days ago saw a little guy in the office whose last name was Bork and dove right into my favorite hockey player of all time.
Yeah.
Ray Bork. So yes, that was a duct tape musette that my daughter had made for me, which still hangs in my what I affectionately call the wattage cottage, the little shack out behind my house where I ride my exercise bike, and I take it with me when I travel with my bike tools. So, wow. Okay.
Yeah. We discovered that we both appreciated hockey and 80s metal. Very quickly, I think.
Yeah. What's my walk-on song? What are you going to play at the beginning of the episode?
Do you know what would your walk-on song be?
Yeah, my walk-on song would have changed over the years.
Yeah. And
so, God, what would my walk-on song be? I yesterday was listening to NPR because, now I'm no longer the same,
That's right.
same kid who listened to 80s metal. But I was doing a story on the Nutcracker, and of course I immediately started humming Nutty, the Bruins theme song. So, I might steal a page from TV 38 of my childhood, watching Bruins games at my grandmother's house on Sunday night and make it Nutty.
I think that's valid. maybe I'm going to start asking everyone what their walk-on song is going to be. I have to think about that.
But my current day walk-on song, I think, would probably be something from Wilco, because, as you know, I've become a little bit obsessed with that particular band. I'm trying hard to keep them from being the top band in my Spotify Wrapped year after year after year.
Oh,
so I will throw out. I'm going to throw out a bit of parenting advice because I'm a pediatrician. And that's what I do, is give unsolicited parenting advice. One of the most fun things that I've ever done with my kids is that for every gift giving occasion, so birthday, Father's Day, holidays, I request one gift, which is a Spotify playlist of songs they think I will like. And I have discovered the coolest music that way. It's really, really fun to see how my three kids they all love music, and our family all loves music. And so they all have different musical tastes. And so I get, these really amazing playlists, and that's what I listen to nonstop all year long when I'm not listening to Woka or Wake Jesus or Woka Jason. Yeah.
I learn what my kids like now when I get in a car with them and they're driving.
Yeah.
And all of a sudden I see their playlist and I'm like, wait, what?
There's always a wait, what? Oh, I didn't know that's what she sounded like.
Exactly. Yes. Yeah. It is good though for trivia purposes to play trivia with your kids because they know all the new stuff.
Yes.
All right. So we've established though that you're originally a New England boy, but you are far from there now. So why don't you tell us about your practice and how you got there, please?
Sure. I'll start in New England if that's okay. I grew up in Massachusetts, southeastern Massachusetts, a town called Fall River, as we've mentioned. My parents are from the Azores, and so I am Portuguese of Azorean descent from the island of San Miguel. They moved to the U.S. just before I was born. So I was born in Fall River, went to school in Boston, went to BU for college and for med school. And then while I was at BU, I met Nell, who is my wife. And, I think within a couple of minutes, a couple of days of us meeting and starting to date, she said, I'm applying to grad school. And if I get into Berkeley, I'm going back to California. And so I was warned from the beginning, and she did indeed go to Berkeley for grad school. And so I applied for residencies in the Bay Area and moved out to Oakland. I did residency at Oakland Children's, had an amazing experience there. And then from there, Nell and I moved to the Navajo Reservation. We lived in New Mexico in the Four Corners in a town called Shiprock. And so I worked on Navajo for 3 years, moved back to California when our daughter was 1, and spent 4 years working at an FQHC here in Marin County. So I live and work north of San Francisco in Marin County. And after being at the clinic for a few years, had the opportunity to join the practice I'm in now. I had done, like, so many of us, some hospitalist work and after hours clinic and, different things, and joined my current practice, Tamalpais Pediatrics, 20 years ago, a little over 20 years ago. At the time, it was, Roe Mazel, Heath Harvey, Lee, and Branco. And within a couple of years, or about a year after I joined, I became the managing partner, and what was one of those, last person to step back gets to do the job. So I became the managing partner and decided that we needed a website, and to have a website, we needed a better name than Roe Mazel, Heath Harvey, Lee, and Branco. And so we named ourselves Tamalpais Pediatrics after the mountain, which is the geographical feature, or what we call a mountain, what those who live in actual mountains would chuckle at. But anyway, Mount Tamalpais is where we're at. And so we're Tamalpais Pediatrics. And we've, kind of grown the practice from what was at the time that I became the managing partner, 5 pediatricians and 1 PA, 1 nurse practitioner. We are now 9 pediatricians, advertising for a 10th, 3 pediatric nurse practitioners, a lactation consultant, nutritionist who consults with us 1 day a week, and a behavioral health department, which includes 5 therapists, a part-time child psychiatrist, and a brand new part-time psychiatric nurse practitioner.
That's all. That's it.
So far. I mean, we have ideas, Chip, right? We, one of the things that is interesting, and one of the things that I've learned from friends and colleagues like you, is to be prepared to respond to opportunities. And so, people become available. Our psychiatric nurse practitioner is a great idea. A great example. We tried to hire her as a pediatric nurse practitioner when that's what she was doing. Our schedule needs didn't quite match up with her schedule needs. And so, fast forward 5 years later, and they've gone off and done a training program to become a psychiatric nurse practitioner. And we've added behavioral health, and we could always use a little more help with the prescribing side of our behavioral health team. So we made it happen. And, we were lucky that we were in a position where we could take advantage of that opportunity.
Let's make your own luck. That's awesome.
I will tell you, if an optometrist walked through the door tomorrow and said, "Hey, I have experience in pediatric optometry," I would figure out how to make it work for a pediatric optometrist, because that's a need in our community. We have a hard time getting our kids into ophthalmology. A lot of them only need optometry. And so, that's the kind of thing we think about, is what are the opportunities, what falls into our laps, and how can we invest and leverage our resources to make it happen.
Yeah, I think if the specialty has the word pediatric in front of it, you need to slow down before you walk away. Can you imagine if every pediatric practice had a pediatric dentist attached?
Oh,
we can all drink. Yep.
Yeah. We're lucky that we actually have a really excellent pediatric dentist, and we have lots of pediatric dentists in our county, but we have one that we work really closely with, who helps us stay up to date on the latest dental science. And that's been key.
Oh, yeah.
Something that I talk about a lot, that you talk about a lot, is, find your friends in the community, and stay connected.
Oh, I think so. I think that's awesome. That we and others have leveraged your experience and certainly your willingness to observe opportunities, especially when it comes to behavioral health. I usually don't go down this path, but I'm curious to hear what you think the future of behavioral health is for pediatricians. That's all.
Yeah.
Yeah. Well, I want to know what you're seeing, because you've been on the cutting edge of it for a while. And
is this where I'm supposed to make the crystal ball joke? Let me pull out my crystal ball.
Yep. Because if you could solve this problem, you would have.
Right.
That's,
I will tell you. So I think it's no secret we're all sort of inundated with needing to deal with mental health issues in kids and teens and parents, frankly. There's so much information out there that teens are exposed to. The way that they talk about mental health and behavioral health and wellness has changed. The way that we talk about it has changed. And so I think part of it is we're all sort of playing catch up. It's always been an interest of mine. I was a psychology major as an undergrad. I thought for a little while that I'd be a psychiatrist until I did a psychiatry rotation. My wife is a therapist, and has a public health degree. I, thought about doing a behavioral developmental fellowship before I went off to work in the Indian Health Service. So it's always been part of my career, and I've always really appreciated the way that in pediatrics we think about the whole child, right? We think about mental health and family and community and social determinants. And so I think that having behavioral health integrated into a pediatric practice is it's kind of a no-brainer, right? What's stopped it from happening is this crazy way that we pay for healthcare in our country, where apparently the eyes, the teeth, and the psyche are totally separate from our bodies, and don't get paid the same way. And so I think we would have done this a long time ago. If I'm looking into the future, what I would love to do, and this is a puzzle that I'm actively working on and have not yet solved, is to figure out how to bring our pediatric perspective on growth and development and anticipatory guidance to mental health. Right? Is how do we help on the parenting side? How do we help early on to not just identify kids? I think the screening is all super important and really excellent. And so all the ASQs and the MChats and the Edinburghs and all the stuff that we're doing. But how do we get ahead of this, right? To build a little resiliency in our kids, to build ways to think about and talk about mental health where they're getting help from us or from the adults in their lives, from people who really have the resources to help them, rather than from social media and their friends who are an awesome source of support, but may not be the most skilled at helping them. I want to get ahead of it. I want anticipatory mental health, and I think a lot of the stuff that AAP is doing around relational health is getting to that, and so I'm super excited. I'm on a bunch of different AAP committees and work groups, and folks like my friend Joanne Young over at UCSF, who's doing a lot of the relational health work. I think that's the future. Sorry, long answer, but
no,
that's what you and I do.
Yes. Well, the thing that it's amazing that this is an issue that the market hasn't addressed or solved, because clearly every zip code in the United States could use a few dozen mental health practitioners. And the demand is almost endless.
Well, yeah, yes, and I'll tell you, in our market, so in our county, and you can't throw a rock without hitting a therapist. There are a lot of therapists and a lot of really good therapists, a lot of skilled folks, a lot of folks who work with kids and parents. But in order to survive and to be able to pay the rent and draw a salary in a place like Marin County, most of them are private pay. And so when we started our behavioral health program, the very foundation of it was, let's find a better way to do referrals. And then from there, we recognized we can't make referrals well enough that people will access those services when they have Medi-Cal or Medicaid insurance, or when they are one of these families who, they have a job, they have insurance, or they're on one of the exchange plans, but there's not a whole lot left to pay $250 an hour once a week or once every 2 weeks. So we started by trying to increase access for families that didn't have access otherwise. And so, yes, every county could use more mental health, but I would put an asterisk on that, is every county could use, covered or affordable mental health support.
You're not going to get any argument from me. But I certainly, I would much rather solve the problem of having too many mental health professionals.
Straight up. Yes.
That's part of you.
Because then we just have to figure out which ones are the good ones, right? Or which ones are the ones that practice the way we practice and that we think our patients will connect with.
You'll love
choice.
You can see them in 3 weeks. You're the best. You are the best at it.
Well, and for mental health, even more so, right? I mean, we sit here in this bounty of pediatric specialists, right? There aren't very many here in Marin County, but we cross, 2 bridges, and you've got pediatric specialists like you wouldn't believe, at Oakland Children's Hospital, at UCSF. And if you're crazy enough to want to drive an hour and a half or 2 hours, you can go to Stanford. So we have so many pediatric specialists here. And so how do I make my decision? Well, you're a family that I think is really going to like Dr. Diab at UCSF, and you're a family that I think is going to do better with Dr. Sabatini at Oakland Children's, right? And so trying to figure out, you're a family who's going to really connect with this mental health specialist who is actually going to be able to see you and who you will be able to pay for, as opposed to just call this number and take whoever is available. Because often that's what we're doing in a lot of places in the country. And, sometimes it works and sometimes the click isn't there and kids aren't getting the care that they should, because they just don't have the opportunity to build a relationship with the therapist.
Yep. I think the desperation that parents feel in that circumstance it ends up driving suboptimal results.
Yeah.
It's you don't have the opportunity. You don't really have the opportunity to back out and say, "Oh, is she working for us?" Because you don't that or nothing, and nothing is scary.
Yeah. The other thing though that's interesting is again, let's recognize our biases. Which is that there's a lot of stuff that works for kids that we may be surprised at how well it works. I mean, one example being, right, for a while I was getting all these folks who are working on text mental health support or other online apps, right, where you kind of work through a CBT program using an app on your phone. And I remember, like, I would listen to every pitch because I don't know what's going to click for my patients. And there seems to have been a little less energy in that world right now, but there's a lot of stuff like that. I mean, my wife now works for a hospital in Tuba City, Arizona, on the Navajo Reservation.
Yep.
And she's a therapist, as I said, and so she's a therapist on Zoom 6 out of 8 weeks. And so she's here in California, either at home in the corner of our living room that we call an office, or she's in an office that she rents here, and she Zooms into a place that could not be further away from Marin in a lot of different ways. And she's talking to kids at the high school there. She's talking to kids in the mental health clinic. She is, integrated with the pediatric department. My dear friends and colleagues in the pediatric department there know her and send her patients. And then every 2 months she goes out and she sees some of her clients or the patients in person, and she takes some ER call. And so it's been this really interesting way where that Tuba City, which is a place that has a hard time recruiting mental health folks, has been able to provide, I'm biased, but I think Nell was a pretty excellent therapist. And so she had been able to provide really excellent mental health support to mostly kids and teens that she sees. And there's a team, and there's lots of other great people there, but, they were flexible and creative. And, I'm grateful for having made the connection out there when we were there during the pandemic, helping out, that she was able to take that job and do that job.
Do you, I might delete this from, the podcast, but I'm waiting for us to cross the Rubicon of AI as a true clinical resource, because I see the utility. I also see the dangers, but I see the utility of AI for behavioral health. And I mean, I'm much more of an optimist on things like this than most people. But if your option, we already see people using it. I think people are doing it already on their own.
Yeah.
And people are doing it because they're lonely, because AI can be friendly and thoughtful. And part of me says, boy, what if we could really leverage, what if we could keep people from having no I'm not saying this right. What if we could at least give options to people who have no options?
Yeah.
And I don't want to say it's a long way away. It's a way away. But it's coming faster than I think anyone expected.
Yeah. And, if you decide you want to keep this in the podcast, I will give you my perspective on,
please.
So I think, AI is a tool, that we have not yet figured out exactly how to use, but it's becoming more and more clear to me that, it's a tool that needs to be in human hands and directed, as opposed to a tool that we just sort of send off like a robot to go and do your thing, right? So I'm beta testing Martin for PCC. I've been using it every day for months. I always joke with kids, is it okay if I turn on my robot who's going to take notes for me? But you know for a fact that I am reading every one of those notes, and I'm only
There's a reason you're being tested.
yes, yeah, right, and sometimes Martin gets it wrong, and that's okay.
Very wrong.
Yeah, and that's okay because I was there too.
Right.
If I wasn't there, that would be a problem. And I have a good friend from college, my roommate from college, who works for the tech section of the New York Times, and I had a conversation with him about AI. I said, "So what do you think? Is it a bubble? Is it going to go away?" And his take was, "What's going to go away are all the character AI, all the vanity projects, the sort of AI pals, and what will stay is AI as a tool integrated into other tools." And I think he's right. I think that I was having a conversation with a friend, another cyclist, a couple of days ago, and he was talking about how he's using ChatGPT as a trainer, as a coach, and he feeds his workouts into ChatGPT. And I'm like, okay, dude, first of all, you're not that good a cyclist. You don't really need to be feeding all your workouts into ChatGPT to figure out how your FTP changed from
He's not going to listen to this.
Sunday to Monday. But he's having such a good time, and ChatGPT is telling him, "Hey, today you should do a half hour on Peloton since you don't have access to riding outside, and tomorrow you should just do stretching and yoga, and you've got this big party coming up." And so he has a relationship with ChatGPT where it is helping him create this program. If he actually had a real coach, someone who had done this professionally, who was fact checking his ChatGPT training plan the same way that I fact check Martin's notes before I incorporate them, right? Open evidence. We've been using open evidence in our office. Like I love it because I'm too old for going to up to date every day. Right? I used to use books, and so, but open evidence helps me kind of figure out, okay, well, I can follow these breadcrumbs and go to the paper and find that review article. And so I think AI as a tool in human hands, there's a future for it in mental health as well, right? Yep. Like, this is your homework, and your AI buddy is going to help you do your homework, but then I'm going to be looking. I'm going to check that next week and make sure that the AI buddy hasn't gone off the trail.
And one thing I find interesting in some of these AI discussions is that we presume the human is the less fallible element. And I'm not giving you grief, okay? No, but you know what I mean? Like, there's a point at which fallibility of any source, human or otherwise, where it gets small enough that it is indistinguishable.
Yeah.
And we're not there yet. I'm not advocating for the arrival of our new AI overlords.
No.
I'm stuck thinking about a book I read, I don't know, 20 years ago called The Cunning Man. It's by this guy, Robertson Davies. He's considered like one of Canada's great authors. And he wrote a bunch of books that are a lot of fun to read. They're basically mysteries, but there's a tremendous amount of what would I call it in there? Like, just fun, interesting content. Like, you learn all about automatons at a circus, or you learn about how to repair a violin, and they're fun reads. But the Cunning Man is a whole treatise he does on primary care, because the lead guy is like a GP in Toronto I'm gonna get my dates wrong, but like in the 50s or 60s, and one of the elements of the story, it is a mystery, is how, as a GP, most of what he does is just listen to people. And he talks about how most people just want to be listened to and be told, I understand you're unhappy, or I feel your pain, and maybe we can do something about it. And I'm like seeing more and more examples of where AI is listening, even though it's not. People have this craving to be heard, and if we can find someone to hear, I don't know. I'm waiting.
I'm going to give you another yes and, right. And this is my so yes, that people need to be heard, and I actually one of my core beliefs is in relationships, and you've known me long enough to know that's what I value. And I my criticism of corporate medicine, of hospitals and whatever, private equity, et cetera, is that sometimes when they buy practices and they try to run doctors' practices, they don't understand that we are a relationship business.
That's how I feel. Yep.
I'm preaching to the choir. And I think the same is true with the AI stuff, right? And even with some of the newer models of care, the One Medicals and the Carbon Health, and there's a couple. I live near San Francisco, right? So there's always a new tech-infused primary care practice that's getting started. And as I said to maybe it was some kind of product designer, or maybe it was a software person who was pitching, what do you think about this product that I'm working on, or I just got $1 million from a venture capitalist to develop. And I said to them, any product, any piece of software or device that helps me increase my connection and my relationship with my patients, I'm all in 100%. I'll buy 1,000. But if it gets in the way or it tries to supplant, then that's a problem, right? And I'm going to be controversial here and say, like, patient portal, I love the patient portal, because the more access patients have to me, the easier it is for me to take care of them when they need to be taken care of. And I actually find that, yes, there are some parents who will send lots and lots of little messages about things that I may not think are a big deal or worthy of waking up at 2 a.m. to send a message for. But there's a couple of things: is they know they can get me when they really need me. And I think patients need me less because they know I will respond when they have that need. And the other is, honestly, that parent who's sending, in quotation marks, too many portal messages, that tells me something.
Right.
That tells me something about them and their parenting style, and maybe their own levels of anxiety or confidence or lack thereof in their parenting, and what kind of support they're getting, and so on. So then I can, address that. My relationship with my patients is my superpower, and follow up is my most potent clinical tool. And
I wish you could see me nodding furiously right now.
Yeah. Those are two things. I mean, you've heard me say these things before, because you've known me for, whatever it is, 15 years, or we'd have to look at when NCE was in San Diego and I was reading my Bruins bag. But anyway, that, these are sort of core beliefs for me. These are things that I always come back to.
Yeah, I always, you've heard me say the problem that the private equity guys have, or it's not even private equity, it's the large systems, is that relationships don't scale.
Right.
And you can't buy relationships. Right. You can invest in them, but you can't buy. And I could not agree with you more. I saw someone posting on Sopum the other day about the debate they're having in their practice about turning on some portal functionality.
Oh, yeah.
And I was just like, I didn't reply to it because you are missing the boat.
But we do that a lot in medicine, right? You can take that same concept and apply it to how we build our templates, right? So every pediatrician in the world. I was talking to a neurologist at a couple of days ago, and this is an adult stroke neurologist. And, we were just talking about sort of how our day works, right? And so, like, I start my day, I've got, 8, 9, 10 patients on my schedule. I know by the end of the day, I will double that at least. And, and if I don't double it, oh, what a great day. Right? I got to actually spend a little more time with everyone. But we do that because we're always afraid of that big wave, or that kid who needs to be seen today. And we have to take care of ourselves and our staff, and we can't stay open, 24 hours a day unless that's your model, right? So we leave acute care time to protect ourselves. You are always making the case that you should be doing, a higher percentage of well care. I've been really trying to emphasize the well care, looping back to my whole concept of preventative mental health, right? I think well care, I think when I sit in that visit with your 8 or 9-year-old and we talk about Little League and Legos and, what their friends are doing and are they on Roblox and for how long, that's how I build the relationship that will allow me to talk to that kid as a teenager about sex and drugs and, mental health issues and the breakup and all these things that are hard to talk about. If I've got that relationship, then I'm there. It's easy.
Yeah, trust is gigantic. You earn it by showing up and listening. So I'm with you on this. And little did I know. I mean, you knew. Well, let me ask you this. I should ask everyone I talk to. When did you know you wanted to become a pediatrician?
That's a good question. My mom will tell the story of me, poking holes in the couch with my with the syringe from my doctor kit. I actually started college as a computer science major. And because my handwriting was so messy, they actually made me a math major for a semester. And I was like, oh, cool. I'll do math. That's fine. Until I got to discrete math. And I was like, no, I'm out. So I tapped out of math and did computer science, learned to program in C before the pluses got added on. And then became a psychology major because I was kind of lonely in the computer science lab at night. And I really loved psychology. I always did, right from high school. Like I said, I worked at Boston Children's, and I thought I was going to be a psychiatrist until I did pediatrics in medical school. And I was at Boston City Hospital with, Barry Zuckerberg and Ben Siegel and Bob Vinci and all these people who were just, mentors. Perry Class was there, and these people who really were on the forefront of what we now call social determinants of health. And I was hooked. That was it.
Well, I did not know that about you. I know that I had no plan whatsoever. And I ended up in a business where developing relationships turned out to be really important. It's just that worked out.
And we have all benefited. I hope you have benefited as much as we have, Kip.
Well, I know that I like my job. It is funny though. There's when I was applying for jobs, I applied at 2 places here in town, and I had job offers effectively from 2 places at the same time, PCC and this other business. The other business just sold out, and the employees who work there got payouts in the 8 figures. I was like, oh, what?
Oops.
It's intrinsic reward. That's why
I'm gonna just comment. I think I've listened to enough of these podcasts to know that at some point during the discussion, Chip and Polly's pandemic webinars has to come up. And we've all expressed to both of you how grateful we are that you were there to kind of give us a place to share information and learn and, provide some, a touch point, right? A community during the pandemic when we were all so anxious and uncertain and didn't know what was going on. I will also tell you that, I was the least surprised that you can be that you and Polly were the ones to do that. Because you and he and folks like Suzanne Madden, and I'm not going to try to name all of the folks who are in our pediatric orbit, but you've been there for us because you care about kids too, and you care about our practices, and you care about our ability to provide care to our communities, and so thank you. I've said that to you before, but thank you for the pandemic stuff. But before that, thank you, and since that, thank you. It's important. I've learned a lot. I joined SOPM 20 years ago. I've learned a lot from SOPM. I've learned a lot from you. I've learned so much from my PCC friends and colleagues, both the clients and the PCC employees. So I wouldn't be in a practice that is doing what it's doing now if it weren't for all of that.
Well, I've learned to say you're welcome. It's comfortable. I don't, I'm glad that Paul and I had that opportunity because it was for my own self care as much as for everyone else's. We were all there together. We were all saw what was going on, and
all of
right, and it was Paul and I were gathering our friends as much as we were doing anything else, and so it's interesting. You learn. It takes a pandemic to learn who your friends are.
Go figure, huh?
Yeah.
Yeah.
All right.
Before we move on, I just want to make one comment that I always find it very amusing that you and I are both big readers. And I think we have many times over the years talked about books, yet the Venn diagram of books that you have read and books that I have read barely overlaps. And I always find that really hilarious. But anyway, let's move on. Next question.
All right. Next question. All right. So I get to ask, what is keeping you awake at night right now? And you can answer as a pediatrician. You can answer as a managing partner. You can answer as a dad. But what's keeping you up at night?
I'm gonna choose to answer as a pediatrician because I've listened to a few of your podcasts, so I was anticipating this, and I think it ties to what we talked about earlier in the behavioral health, but it ties to that. Related to a topic that our good friend Jesse Hackel spoke about at the NCE, which is workforce. I think being a primary care pediatrician is really hard. And it's harder, arguably, and I think I would win this argument, than it was when I started practicing 30 years ago. I was out on the Navajo reservation, 4 hours away from the nearest children's hospital, and we were doing spinal taps in the clinic because we were ruling out meningitis, and we had kids with really bad RSV and kids with varicella cellulitis and all these things that we just don't see anymore. I mean, I haven't admitted a child with rotavirus and dehydration in, I don't know, since about 2 years after the rotavirus vaccine was introduced. So my job now is a lot of behavioral health and parenting support and school problems and ADHD management. And I'm really, really blessed that I have the colleagues that I have and the resources in my practice to be able to get support for behavioral health, because just like when I first moved to a place that had hospitalists and I didn't have to run out of clinic to go to a C-section or to go do an ER consult or to go do a spinal tap before running back to clinic to see all the patients who were waiting for an hour. I was so happy about hospitalists and thought, oh, now I'll be able to practice way longer. Call nights are so much easier. Behavioral health for me is exactly the same. I have behavioral health professionals that I can pass on a patient to when they're in crisis and know that they're going to get really excellent care and arguably more well-connected to follow-up and ongoing care than if I were the only one seeing them that day that their PHQ was a 21. I have psychiatric colleagues who can help me when a kid is having some side effects on a medication and I can't quite figure out if I should adjust it or change it and what I should do. So I worry about workforce because I think unless we find a way to help pediatricians who are in training manage what it's like to be a primary care physician and have to figure out which kids to work up for celiac disease and which ones need to go see the specialist and which ones, are going to do well on Concerta versus Adderall versus Strattera. We really need help with that. And so, for me, it's workforce, and that's related to what we talked about earlier in mental health.
All right. Good answer. I mean, you're always there's, what are you excited about? What are you looking forward to?
I'm looking forward to, I love my job, right? I love the relationships and connections that I have with my colleagues and my patients. And I'm excited about what we've been doing and will continue to do in our practice with behavioral health. I'm excited about sharing information. I have I've done a couple of talks on behavioral health integration and talking about our journey, and share lots of resources that I've accumulated. And so I'm excited to kind of watch pediatrics move into this next phase and to help make it happen effectively.
All right. What advice would you give yourself 20 years ago, knowing what you know now?
I'm going to quote the advice I gave my younger self when someone from PCC interviewed me for the Independent Pediatrician several years ago, which is to say, who you work with is just as important as where you work. Or some version of that, because I have really appreciated over the years that the relationships I have built with my colleagues in my practice have been super important. The relationships I've built, within the AAP and SOPM and at PCC and at PMI and all these other groups that I'm part of, the people that I have ended up working with have made the experience rewarding or not rewarding in equal measure. And so pay attention, work with people who you like, and work with people who complement you.
Yeah, I like that answer. I mean, you know how much I like that answer.
I'm not playing to the crowd. This is, it's in writing in the Independent Pediatrician, one of the first few episodes. So you can go back and fact check me, but that is, again, another one of my core beliefs.
Yep. Well, you get to an age, and you and I are at that age, where you're like,
certainly are.
why do I have to keep putting up with this? Why don't I working with people I like to work with? Not only makes the work more enjoyable, but you get more done and you do better work.
You do better work. And I say that, I don't want anyone to interpret that to mean that you should work with people who always support everything you want to do or say everything you do is great, because some of my most valued relationships are with my partners who always say no first.
Right.
And I say that jokingly because it's not exactly true, but it is true, because when I come up with some crazy idea, hey, let's hire a therapist, for them to say, hold the phone, is super helpful, because being able to articulate why it's a good idea and what the risks are and what the benefits are and how you're going to navigate the risks should they arrive is super important. It's, it's
forcing
how
you to have
plan.
discipline forcing the discipline to
be
make
thoughtful.
you think through what you want to do. Yeah, it's huge.
Yeah.
And then they know when to say, okay, you've jumped through my hoops.
Well, and you also need to, I think, be around people who will say, okay, fine, I'll go along. Let's see what happens. And that's a skill too, and that takes a lot of trust.
Boy, you give me all the good answers. Well, thank you. I appreciate it. And I'm sure I'll see you. Are you going to be at PMI soon?
I will be at PMI. I will see you in New Orleans.
All right, you'll see me in New Orleans. I'm sure we'll see the rest of my listeners so far.
Yeah. I'll see if I can dig up my my Bruins musette.
Oh, that I'll spot it from across the room. Well, thank you for joining me today. I appreciate it, and we will chat soon.
We'll chat soon. Take care, Chip. Thanks so much.
You too. All right.
Bye-bye.
Thank you for listening. More information can be found in our show notes. Production and editing by Chip Hart, Ali Squires, and Chris Forleo. Music by Challenger C. I'm Mark Herney.